Okay, so now a big topic that comes up, conjunctivitis or pink eye. And once I used the term conjunctivitis with a patient, they said, "What?" And so I realized that's the it can sound fancier than it really than I didn't realize I was using a fancy word when
Yeah.
I said conjunctivitis. But I'd love to talk to you about what parents should know about pink eye or conjunctivitis.
Okay.
In general terms, do you have any? Can you explain what it is exactly?
Um, so conjunctivitis is just the very outer coating of our eye that has a lot of vessels to it. It's there to kind of help keep the eyelids moving smoothly. It helps the tears. It gives a barrier so the tears kind of float on it. Um, but it doesn't really. It can be red and irritated, but otherwise doesn't have much function as far as vision. Conjunctivitis kind of goes into three categories, and there's a pretty easy way you can break it down based on the symptoms. An itchy eye is going to more than likely be allergies, an itchy red eye. An eye that is has wakes up with a lot of mucus and then they just get mucus all day long and it's red. Those are the kids who are going to be a bacterial pink eye. And then if it's a watery eye, it's going to actually be more red, super red, really watery. Sometimes they have other symptoms with it, but oftentimes they have kind of some big lymph nodes. And those are the kids that are viral pink eye. So when they come in without doing any testing or anything else, you can kind of just base it on their symptoms, what sort of pink eye or conjunctivitis they have.
This is so helpful because a lot of parents, they see redness in the eyes and they automatically want an antibiotic. And I think that's maybe the fault of the medical system. We see pink eyes, we give a lot of antibiotics, a lot of drops for red eyes. But this distinction I think is so helpful because what you're saying is that not every kid with red eyes would benefit from drops because it's the bacterial goopy eyes where antibiotics are beneficial, correct?
Correct. And even in bacterial pink eye, um, it will go away on its own in almost a majority of cases without us doing any antibiotics.
What?
By
This is
doing
breaking news.
antibiotics, by doing antibiotics, it does help it to go away sooner.
Yes.
It decreases their chance of infecting somebody else because you're knocking down those bacteria sooner. So it allows your kid to get back to school sooner. But most patients get better on their own. And almost any antibiotic, when they study them, is equally effective in bacterial pink eye. So there's not one specific antibiotic that any parent or kid should be on. Any antibiotic, for the most part, can help with bacterial pink eye.
That's nice to know because there's such a range in price
Yes,
for eye drops. So it's nice to know that we can stay with the least expensive options and know we're still giving good medication.
absolutely.
The other thing that I think is interesting about that is um, the other thing I think about when I give eye drops is they don't seem very harmful in the sense that, yes, they're uncomfortable to put in the eye. It's something, I mean, that's the biggest thing for me is I know kids don't like putting drops in the eye, but I see them differently in the sense like when I prescribe an oral antibiotic and kids may get diarrhea, rashes, they have more side effects from oral antibiotics. It seems like the eye, there's very little harm from placing drops.
Yeah, for the most part, antibiotic drops are safe. It to get the eye drops into kids. One technique we do in the office is just have them lay back, lay flat, close their eyes, put a drop in the inner corner of the eye, and just ask them to open their eyes and blink it in while they're still laying flat. A drop is more than an eye can hold, so that's one way to get it in. You can kind of do the same thing with ointment. It is true, antibiotics for the eyes don't have a lot of systemic effects. You can still have allergies to it, but also there is the health of society a little bit where we talk about antibiotic resistance. So if you give antibiotics and the parents don't complete it because it's too much work, or you give antibiotics and the parents kind of use it sporadically, they're going to make bacteria that occur that are going to be resistant to antibiotics. So the next time they could get a worse infection that maybe doesn't respond to the antibiotic because they didn't really use it appropriately. So while antibiotics are benign, it's still something that you give it only if they need it and
Yes.
have a tendency not to overprescribe it.
Yes, of course. No, that makes complete sense. You want to use it when you need it, protect society from resistance, and also why bother a child if they're not going to benefit?
Absolutely.
So now there's a lot of rules that schools have about sending children back that children can go back to school if they've been on drops for 24 hours. Do you agree with that recommendation? Does that make sense?
It does. But if their eyes are red and they're allergic, it doesn't matter because they're not contagious.
Right.
Bacterial, yes, after 24 hours of antibiotics, it does make them less likely. But viral pink eye, it can be contagious for up to 14 days. And the eyes can be red for 3 weeks. So you have to create this balance. And I tell the parents, your kid is going to be contagious and we can't stop that. I can't tell a kid they can't go to school for 3 weeks because they're possibly contagious for that time. So when they're most sick, you can you can have them stay home for a day or two, but just hand hygiene, making sure to be aware of the other kids, make sure your kids know that they are not to touch their eyes at school and to wash their hands more often.
I read once in the Pediatric Infectious Disease Society recommendations, they actually did not advocate for keeping kids home with conjunctivitis because they said that likely the damage was already done before the kid had symptoms of, really manifested goopy eyes. They were likely contagious before that point to the other children in daycare. So why have parents miss work and keep kids home? And likely so much of the time it's viral anyways. So it's a tricky situation.
Is that not true for everything though? By the time you come into the doctor, the kids have already been sick for a long time.
Yes.
And Dr. Hockman, I don't know if you noticed, but this year is one of the worst pink eye years I've had in my whole career. I'm like, for 15 years, and this year every kid has pink eye, and it's all bacterial. So we'll be seeing a lot of it this year.
Yes, and anecdotally, I have to say the drops do seem to make a difference.
It does. It makes them feel better. You feel better sooner. And so but I do have a few patients that say, well, my eye is red. Now, here's a caveat. If you have a kid and their eye is red, and it's red for more than, 2 or 3 weeks, even if you say, well, it's just probably pink eye, bring them in. If they're super light sensitive, bring them in. So if there's anything beyond just a red eye, if they have other symptoms, have them come in to be evaluated. If they say things look fuzzy, but more so if they're light sensitive or they say that their eye really hurts, it doesn't hurt to have them come in because there's lots of things that can create a red eye and it not be pink eye.
Yes.
And so don't just consider every red eye to be a conjunctivitis or a pink eye.